2 weeks ago, we started a new segment on this Kakaki, the African Voice, to raise awareness on cancer. And this will be coming up every second and fourth Wednesday in a month. We'll be doing this in conjunction with Comrade Cancer Foundation. The founder of that foundation, Dr. Denise Ejoh, who is, or rather was affected by cancer, was our guest in that maiden edition. There she is. She joins us from London this morning to look at some of the issues related to cancer and how it can be curbed. Also, the second episode, which is coming up today, we will be focusing on breast cancer. And that is particularly because October is Breast Cancer Awareness Month. So we have joining us right here in the studio, a radiation and clinical oncologist, Dr. Jummai Jimeta Tuko. Right here, Doctor. Good morning.
Good morning.
Dr. Jummai, welcome. It's good to have you in the month of October, which is the month for cancer.
Thank you. I'm happy to be here on the program.
It's good to have you always. And also we want to say good morning to Dr. Dennis as well. Saw you earlier. And how are you keeping up today?
Good morning. I'm fine, thank you.
Very well.
Smiles as usual.
You guys are good.
All right, so we'll come back to you, but let's begin with the oncologist in the house. It's Cancer Awareness Month, and women are particularly affected this time around when we say breast cancer. So first of all, let's look at what breast cancer is all about.
Okay. So thank you for the question. I think it's the question is a good way to start. I think we're going to liken, before I go into the definition, I just want to quickly give like a preamble.
Okay.
Of course, we have the body itself is made up of cells and tiny tissues. You know, we have our eyes, our arms. You know, we're made up of components, right? Okay. And these components grow in a controlled manner, in a coordinated manner, you know. So cancer comes in when this process is uncoordinated, is uncontrolled. So that is what we call cancer. When the you know, abnormal growth tends to go beyond its boundaries to other areas. Now, when this process begins or originates in the breast, we call it breast cancer. So in a nutshell, that's just what it is. Uncontrolled, uncoordinated growth in the breast.
In a place where it is not supposed to be.
It is not supposed to be.
All right. Now you've told us that backgrounding. What does it affect, really? I mean, when you talk about breast cancer, I know the first thing that comes to mind is a woman. But give us a background. Who's the main target?
Yes, so just, you know, as you said, when anyone hears breast, you know, you naturally would think of a woman. So, well, they are not too wrong. Breast cancer really affects women mostly. And, of course, the World Health Organization has pegged that about 2 million women have been affected with breast cancer in the year 2020. Down here in Nigeria, we have our figures, you know, went as high as 28,000 in the year 2020. So you can see that's a public health concern. Yes, okay. So it is a concern. And yes, it affects women. But it can affect men. So it's said to affect 1% of cases of breast cancer affect men. So if you have 100 women or have 100 cases of breast cancer, one of those cases would it be affected. A man would have that, carry out that. So it's not, our focus is not just on women. Okay. We're trying to say, you know, men, you have breasts as well. Don't forget that, and you know, you can also get breast cancer.
Is there anything one does really? Is there a lifestyle issue? Is there any way one can actually, you know, be exposed to breast cancer due to how she or he lives his life or her life?
Yes, indeed, definitely. So these factors are things we call risk factors. So I'll also just briefly give a scenario. It's just like a road user. You know, if you don't have your seatbelt on, you know, you drive at high speed, you are more likely to have an accident. If you know, follow all the traffic rules, you are not likely to have an accident. So the same thing for breast cancer. If you have some of these risk factors, you are likely to have breast cancer. If you don't have some of these factors, you are not likely. So I'll just briefly run through the risk factors. You have factors that you can control, within your control. We call those factors modifiable factors. There are other factors that you really can't control. So those factors are non-modifiable factors. So the factors you cannot control are things like age, for instance. You know, as you advance in age, you are more likely to have breast cancer. Family history, you really don't have a choice in that matter. If, for instance, a mom has been affected, or a sister or a cousin, you really don't have any control over that. Then also genetic factors as well. There's a gene we refer to as the breast cancer antigen. That's the BRCA gene. If a woman has that before she turns 70 or 80, there's 80% chance that she would come down with breast cancer. I'm sure we're familiar with the celebrity Angelina Jolie.
Absolutely.
Yes, yes. So she had that, she did a genetic testing and it was discovered. So those things you cannot control. So moving down to the things that we can control, as you've mentioned, lifestyle. We should keep fit. We shouldn't. We should try as much as possible to exercise. Obesity is also a known risk factor for breast cancer. So, we just try to encourage people to, as much as possible, exercise. You may feel, well, I'm not on the big side, I probably don't need to exercise. No, don't get carried away.
Really?
You really do need to, move around, even if it's 10, 15 minutes, anything to get your heart pumping, So you really do need to do that. Then, also what you eat, you have to eat healthy, try as much as possible to avoid a fatty diet and all of that. Then alcohol intake, smoking, those things increase. Yes, then also a lady, if a woman, for some reason or the other, there's a delay in childbearing to above 35, she is at higher risk of having a breast cancer. Then we encourage women as well, when you do have a baby, try as much as possible to breastfeed. Try to breastfeed, because breastfeeding has been documented and established to reduce that risk.
So let me go to Dr. Denise. Dr. Denise, I do not know if you have anything to add to what she's saying or ask any more questions, because I know that I was going to ask about how you know the signs and the symptoms, but I think, with the experience, you're in the best place to tell us that. Let me start with that. So it's over to you.
Thank you. Dr. Jummai, thank you very much for coming on. Now, let's look at it from what she said. What happens with someone that has cancer? But I'm going to ask her a question as well. Okay, so going from the experiences, people that get metastasis, that end up with unknown primaries, which you are fully aware I have. How do they know? I mean, there were no signs. There are no signs. Nothing said there was anything wrong. And the next thing, it's metastasized, and now it's what we're trying to find. So, as a doctor, for the purpose of people who have not been on this journey, and because it doesn't make sense, somebody's well and yet they've got a cancer that has moved, a breast cancer that has moved, and they can't find the breast cancer. So there's no lump, there's no sign, there's no lump. What are the other things people would be able to use to find out that they've got it? Does that make sense?
The question is for you, doctor.
Yes.
Okay, you didn't quite get the question. Okay, Dr. Ejoh, could you repeat your question? The oncologist in the house didn't quite hear you.
Okay, let me go again. Dr. Jummai, very clearly, the medical science, metastasis means the cancer has moved. We agree. For people who get a primary and they can't find the primary, like my case, for instance, having a headache, but till today we cannot find the tumor in the breast, which means that if a woman has breast cancer, for as long as there's no tumor in the breast, they're always going to sit down and say it's not cancer, but it can actually have been a metastasis that would not have been found. What other things could someone like me or any other woman in my position have done or seen, or what other markers would have told us that it was not just as straightforward as that?
Well, so, fine. If I may rephrase, yes. So if like in your case, you had a metastasis at primary diagnosis, at first presentation, Yes, so it does happen. Sometimes we are able to detect, like from the definition I said, it has a potential to go beyond its, where it has originated.
Okay.
So it can spread beyond the breast and move to the brain and other parts, like in her case. So things like that, the patient now has to go through a barrage of investigations for us to be able to know where is this cancer coming from. We know it has spread. We know it has gone beyond where it has originated from. So we do ask the patient to go through a lot of imaging modalities for us to be able to see what we're actually dealing with. Then, as she mentioned, there are also some tumor markers. It's just basically most times you would make use of blood samples to be able to cone down to know where exactly this cancer is coming from. So those are some of the things that we do. Yes, her case is not the usual case, but it does happen. Headache. Yes, yes. Sometimes we have that. So we, in that kind of case, we say this patient has a metastasis at first presentations. It's rare, but it can happen. So the usual thing is they come with breast lumps. They come with nipple discharge, skin changes, sometimes lumps in the underarms, and all of that. Yeah. So that's usually the usual signs. But I'm really glad that she brought that up, because yes, it can happen. We see that a lot. It's not common, but it can happen, where at the first time you are meeting the patient, it has spread already, and you're unable to know where it started. So it's like you're now going, from the bottom back up again. And
well, do you start treatment when you find that kind of patient without knowing where it's originating from? Yes.
Okay. Yes, depending, we have to start treatment, because at the site of metastasis, that tumor is not going to wait. It's still going to keep growing. So we have to really, step up our game and make sure that we're able to make that diagnosis in the shortest possible time. But it's not going to stop treatment. There are guidelines for such cases when they do arise.
All right, let's have Denise ask some more questions, because it is said that he that wears the shoes knows exactly where it pinches. So based on your experience, do you have other questions you want to ask Dr. Jummai here?
Okay, there's one other question I'm going to ask, and this is again for us who are sitting on this chair of cancer patients. What would be your suggestion for a cancer patient to be able to seek advice and know when they are in the right direction? I don't know if that makes sense, but when we start the cancer journey, we're very hopeful, because the first word is the C word, and the C word is a very hard word to hear. What are the things that are put in place to support somebody as soon as they're starting that journey, so that they stay on track and are focused to be able to get past, get through? Is it get through, get past?
Okay.
Did you get that?
Thank you. So yes, that's a very good and important question. It is a journey, actually. So just as she said, once the diagnosis comes, it really hits anyone. And of course, for some of my patients, when they hear that, they say, okay, so finally, what is going to kill me has finally come. Okay. So there's that thing of, so that's it, that's the end for me. So we are trying to say that is not so. There is a plan, there is a pathway that, we want to put patients on to be able to take them through that cancer journey and make that journey a bit more tolerable. So when they do have such problems, at least, avenues like this, we're speaking out to people to say, if you do have some of this concern, try to go to facilities that are government approved, facilities that are accredited, facilities that have qualified specialists. Now, cancer care is a specialized kind of care. And, we have a lot of people. I'm a radiation and clinical oncologist. Okay. I specialize in treatment of cancer with the use of chemotherapy and radiotherapy. There are other specialists, like a specialist that would diagnose cancer. That's called a pathologist. A specialist that would know how far gone. That's, with imaging and all that. That's a radiologist. Then you have another group of people. We call them the surgeons, the general surgeons. They are in charge of, surgical procedures if they need to remove the breast or a lump. Then we have plastic surgeons. It's a barrage of people who are concerned with the treatment of cancer. So what we advise is try as much as possible, go to accredited facilities. The problem that we do have is that sometimes patients now eventually get to the right place after they've gone to all the wrong places. So they come to you and, you know, there's really nothing much you can do at that point. It's far gone. You know, so it's at such point it's really, really very difficult to treat. So we are using this avenue, we are using this AIT to say, please, we are trying to preach the word. If you have any issues, if there are issues, you have lumps or anything that you do not quite understand, please go to the hospital. There are people there who can guide you properly. If they do not have specialists, they are able to refer you to centers that do have this thing.
All right.
So that's where go to the right places.
Sir, on the Cancer Awareness Month, October, and how to deal with breast cancer. Denise, I believe you're still there. Did she answer your questions correctly? And I just want you to ask another question because, like you said, it's a journey, and until you go through that journey, you may not know exactly how it feels and what people that go through that journey, you know, are experiencing. So, based on your experience again, what are the questions people that have breast cancer are asking that you want doctor to clarify here?
Yeah.
Okay, another question I'm going to ask again is, Dr. Jummai, back to you again. When we look at the challenges of breast cancer in Nigeria, now let us home it to our territory. In Nigeria, one of the things that has been a concern based on running Common Cancer Foundation is the fact that people do not want to get the help. They run, either they don't want to, or they live in denial, and then they go. They're going after, everybody says, you go to the church, you go to the mosque, you go everywhere else but the doctors. What programs can be put in place from your perspective that can help us to really make people know that, look, a lot of the time we don't necessarily have it as bad as we do, but if we don't take the right options, we are not going to be able to, you know, people don't know where to find help. And so they bury themselves and their heads in the sand.
Yes, so...
do you get the question?
Yes, I do. So, yes, it is a big problem in our environment. Of course, we know it's not my portion, it's not meant for me, I shouldn't be going through this and all that. We know that plays out very prominently in the society. So, you know, if we ask what more can we do, I think we're doing that right now. You know, you as a breast cancer survivor, you've been able to come out, you've been able to do so much, you know, within such a short time to tell people that, hey, I'm going through something very similar and I'm trying my best to live a normal life. So you know, from our end, what we do is we really try to encourage, because there are lots of bad stories about cancer, there are lots of bad stories about the treatment, there are lots of, you know, horrendous stories about the side effects and all. But we are in the field and we know that it's not that bad. There are lots of things that patients go through and they come out stronger. So people like you, a breast cancer survivor, we need more people like you. We need to have cancer support groups to be able to you know, also go to the hinterlands, go to the grassroots and to say, look, even if you do have this cancer, your life doesn't need to come to a screeching halt. You have a life ahead of you and you can move forward with this. There are people who have gone through what you are currently going through and they can come stronger. So I think that, you know, we will keep doing this. There's no end to it. There's no time limit to say, okay, at this point we're going to stop, you know, preaching the word, so to speak. So really, at that point, at the level of denial and all of that, it's more on the survivors to say, look, these people have gone through what you are going through, and they have been able to you know, come up better. So I think that's really what we are trying to do now, and then to also keep educating to say, look, go to accredited facilities, go to meet qualified doctors, meet qualified specialists, because like I mentioned, cancer care is a specialized care.
Yes.
It's specialized care, so you need, not all doctors can treat cancer. So, you know, we just keep encouraging, try to go to accredited health facilities if you do have
sorry
concerns.
to come in here. I know that when the people hear you out there, I'm sure, like you mentioned, the hinterlands, which is at the local government level, and perhaps to them there might not be enough, screening centers as there would be in the urban. What could be your recommendation, especially to the government, because this is also a multiplying effect if we do not look at how to take this treatment or screening down to the hinterlands?
Yeah. So currently there's the NCCP on ground at the moment. That's the Nigerian Cancer Control Program, which spans across prevention, advocacy, treatment, and even survivorship. So it has been, this phase is to conclude at 2020. So that's at the federal government level. Now, trickling it down, there are some states that have been able to somewhat domesticate the National Cancer Control Plan in their state. Okay. States like Kebbi State, for instance. So they've been able to do that and been able to take charge of that and, like you said, move to the hinterlands. They've been able to try as much as possible to train healthcare workers at primary healthcare centers where there are focal people that are able to educate the people around that area in the language they understand and to say, okay, this is the issue. You don't have to hide it. You don't need to go anywhere else. We're available to give you the information. We're available to give you the necessary direction. Now, as you mentioned, sometimes some of these facilities are not available. Yes. It's quite clear. We are not where we ought to be, but we keep making strides, and we hope eventually we'll get there. So fine, what we're saying is, if some of these screening modalities are not available there, if you are able to meet focal people, so in the states we encourage state governments to be able to domesticate the cancer control plan. So it is in existence. So try to bring it closer to the people and trickle it down. So eventually it will get there.
Yeah. Now the awareness. This is the Cancer Awareness Month, and breast cancer. We have to be talking about it. Denise said earlier in her question that many people do not even know where to go to.
Yes.
Where is the information available for people to know that, okay, this is a facility where you can go and get care early enough?
So, well, it's still, like I said, it's still, at least,
is it offered in all government hospitals,
for
instance?
It's not. So that's why I said, the government facilities, they have the ability to be able to do a well-structured referral.
Okay.
Yeah, so that's why we're encouraging people to go, because there is a referral structure on ground. So if you happen to, the facility close to you doesn't have the full components of cancer care, or doesn't have any components at all, there is a structure to say, okay, we don't have this, but please go to the next town, go to the next hospital, or go to the next state, and you'll be able to get that. So that's why we're encouraging to say, go as much as possible to some of these government facilities, whether it's at the state level, state hospitals or local government hospitals, they would be able to give some direction. So we've been working on that, even on our end, because really there are also some people, even within, healthcare workers who probably are a bit fuzzy about, so the training is ongoing to say, okay, this is the direction from here, from, this step to the next step, so that's what, we are just trying to strengthen the referral system as much as possible.
Does
it's
the
not
breast
everywhere as
necessarily have to be removed in the
process
course
of treatment
of cancer, or is there something that can be done to prevent that from happening?
Okay. Yes, that's also a fear. As she has said, I think that's also what makes a lot of people, go the denial path, because you say, oh, my breast is going to be removed. Now, this is very important. It's what defines us as women, our hair, the breast, the uterus, the womb, so you feel, well, I may cover my hair, but the hair, it defines me. I may not, wear what, but the breast, it defines me. I may have, I may not have intentions of having a baby, but the womb, it defines me as a woman. So if that, for any reason, even if it's to save her life, is at some point going to be removed, it's going to affect her. So, but it's not the case all the time. So like I said, cancer is in different stages. You have stage 1, there's stage 2, there's stage 3, there's stage 4. So what Dr. Denise had was stage 4. That's the last stage where it spreads to other areas. But at the early stages, that's at stage 1, where it's confined to the breast, you know, that's the doctors that are in charge of cancer care. We have like a multidisciplinary team approach towards these issues, where, you know, we more or less not necessarily sit on the physical table, but we all have a discussion about a particular case to say, fine, this is small. Do we really need to remove the breast?
Okay, let me quickly go to Dr. Dennis before we go. Dr. Dennis, you've heard a lot that Dr. Jummai has said as well. I just want to ask you, perhaps, you know, for people who are watching, how have you been able to cope, you know, with some of the issues, your treatment process during and, you know, after treatment? Because, you know, she mentioned something very critical about, you know, people's understanding of treatment for cancer and their fear of it. How have you coped?
One of the first things I quickly accepted was the fact that I could go bald. And so for my own dignity, and this is one thing I say as a woman, as you know, you notice I have long hair, and all of a sudden I knew I could lose the hair, but my fear was that I already realized that the hair plucks out like rat is eating the hair. So as soon as I saw the first point come out, I scraped the hair myself, so that I started to feel I was in control of my treatment, my journey, not circumstances. Then I also learned there's a thing about food. I very quickly understood that the treatment can make you not want to eat, and the things then become, if you don't eat, how does your body fight? So some people are of the opinion you have to eat certain types of food, but actually, as somebody who's been through the journey, if you don't eat what you can, then you will not have the body strength to be able to fight your disease, because you need the strength in your body to be able to go forward. You get sores in your, probability is a lot of people do get sores in their mouth. There are specific oral, what do you call it, mouthwashes that are used by cancer patients. And I didn't know that until I found myself there, that it's not all mouthwash agents that can be used by cancer patients. That knowing how to relate, where to relate, your cycle, understanding that when you've had the chemo, there are periods where you should not be around people, because if they come around you, you can get sick. Your immune system is not very strong. Knowing how to build your immune system, those are things I had to learn, and I live by it till today, because I still take treatment. So I will take treatment tomorrow. So it doesn't make, that didn't change.
All right.
But what changed was knowing the different ways to circumvent the issues or challenges that were going to happen, and nobody can tell you until you are in it. You know, everybody's more focuses on being more sorry for you than understanding that I need the skills to get past this.
All right. Well, thank you very much, Denise, for sharing that with us. Quite enlightening, and you know, we thank you, Doctor, as well, Dr. Jummai, you know, for also sharing thoughts on this issue. I believe many Nigerians have learned a lot.
I have learned a lot
today. All right. Denise Ejoh is the founder, Comrade Cancer Foundation. Of course, we're doing this in conjunction with our foundation. Then Dr. Jummai Jimeta Tuko is a radiation and clinical oncologist. Thank you.
We would also like to thank AIT, though, for giving us the platform to create this awareness, because it's very important to the Nigerian public.
Yes, please. Thank you.
And you will see everything that we do here on our Comrade Cancer Foundation. So everything we do with you is there, and people can check your page. You will see us promoting you as well. So thank you.
All right, thank you.